there are some papers concerning the underutilization of epilepsy surgery in both children and adults. So different authors all over the world. We have also a paper published 2 years ago in Epilepsy on trends of pediatric epilepsy surgery in Europe, and the results are all the same. There are too few people that are operated on as children and as adults. So this is an effective, very effective therapeutic option, but well underutilized, because the people are still afraid of the consequences of epilepsy surgery. They want to try all possible drugs. And the other development is that probably we are going to a change of definition of drug resistance in children, because now we have to wait for 2 drugs to be used as in adults. There's no definition in children, so we use what we have for adults, while there are new papers demonstrating that it's important, at least for some etiologies, for example, focal cortical dysplasia, to intervene as soon as possible, because we know that after the first drug is failed, we don't have any possibility to have a drug responder. Another development is in genetics applied to epilepsy surgery. So what we know about somatic mutation and the impact on epilepsy surgery outcome. And our group led recently a paper published on neurology, a multi-center study involving also people from US, for example, from all over Europe, South Korea, and US, about epilepsy surgery outcome in a patient with a new entity called MUGI and SLC35A2 mutations. So this is recently published. And again, we demonstrate that results can be good if we operate with a well-defined pre-surgical evaluations, that genetics is very important. We should perform genetics in patients before surgery, in children at least, in a certain situation, as often as possible, and also to try to detect somatic mutation into the brain. So these are the 2 new developments in pediatric epilepsy surgery: the change of the definition of drug resistance, the role of genetics in the outcome.